Good morning. This is Steve Waterhouse with Predictive Results. I look forward to talking with you folks this morning. Today's topic is how to build a high-performing healthcare team. With Predictive Results, we work a lot with medical organizations using the Predictive Index tool, which is a behavioral assessment tool designed to help organizations hire the right people and manage them more effectively. What we have discovered over the years is that there are some real keys to building high-performing healthcare teams that are missing in many teams. And today we'll try to share some of those with you. What we've discovered, and most of you on the call certainly have experienced all of this, is that a great assisted living organization or a great medical facility needs three things: great facilities, great policies and procedures, and great people. It's certainly not enough to have great facilities. There are plenty of organizations out there that have wonderful facilities and yet don't treat their patients, don't treat their clients, their residents as well as they should. There are also organizations that have great policies and procedures. You can buy those. Consultants will put those together for you and give you what you need to be able to meet all of the federal guidelines and even exceed them in having great policies and procedures. But ultimately, without having great people, without having people that will work within those great facilities and execute those policies and procedures in a way that makes sure that it all comes to life for the patient, for the client, for the resident. Now, people who know the right stuff and do the right things. And we put those in two separate categories because knowing the right stuff is critical. You have to do it. You have to make sure that your people are knowledgeable. I mean, they can have be very caring, but if they don't know what to do, it can create enormous problems. You know how to train those people to do the right things. In many cases, they come in knowing most of what they need to know. They've been through certification, they've been through training, they've gone to college. So having people who are knowledgeable is less of a problem than getting those people to execute on the things they already know. We know statistically that it's far easier to find people who know what to do than to find people who do the right things. And so why do our interviews fail? Why don't we find the right people when we're talking with them? Well, we know from studies of over 50 years following the advent of behavioral assessment technology that what we're looking at when we're looking at a person is not the complete package. Every manager has had the experience of hiring someone and then once you get them in the job saying, where did the person I interviewed go? I want that person that was there in that interview. I want that person that seemed so tuned in, that seemed so right for the job. And yet now that they're on the job, you're saying to yourself, something's wrong here. Something's amiss. This isn't working. Well, what we have discovered is that what you're seeing in the interview is incomplete data. You're not seeing the whole person. And even a good interviewer is not able to predict how that person's going to behave once we get them into the position. Now, here's what we learned. We learned that behavior is a predictable response to stimuli. In other words, if I come up and shake your hand, you will respond to that stimuli in a particular way, and you'll do it consistently over and over again. We know that when we assess someone using behavioral assessments, we know that that stimuli is the same as work stimuli. In other words, we can map what we learn in the assessment world into the work world. And therefore, we know that assessments can predict behavior. As a matter of fact, if they couldn't do that, The EEOC wouldn't allow us to use these tools as a pre-hire tool. So we have to mathematically actually be able to predict behavior in order to use these tools the way we recommend them and the way we do. So we know that personal observation cannot predict behavior. We wish it could, and the best hiring managers wish it could, but you can't look at, you can look at two people who look very similar, and unless you understand their true motivating needs, their true underlying behavior style, we can't get to what it is that drives them. So here's what we need to make a great employee. We need a good match between the job and the position. You know, it's kind of interesting in the medical community. Sometimes if you have the right letters after your name, they put you kind of interchangeably. And I see organizations where an RN will be working in the rehab wing one day and in the dementia wing the next day. Well, those are two completely different styles of person required to work in those two situations. So in order to have a good, productive employee, we need to have a match between the job and the person. Understand what that job requires, what it requires not just from a skill and knowledge standpoint, but what it requires from a behavioral standpoint. And we need to match that with the person. So we need some way of understanding the job, and we need some way of understanding the person. A person needs to feel recognized and valued for the things that are important to them. And that, again, is kind of interesting. I've done an awful lot of work in the sales world over the years. And so many people think that money is the primary motivator. Well, it is for some people, but it's not for others. And so being able to get to what motivates that individual is so critical. Having a trusting and understanding manager. And the key word there is understanding. Having a manager who understands you specifically and knows you as an employee, having a manager that can differentiate their treatment of one worker from another is so important. And giving that manager the insight to understand how to work with each person uniquely really affects how that person affects the client, affects the patient, affects the resident. We need effective feedback and coaching. Key word there being effective. Many organizations have coaching programs. They have feedback. Some companies, many organizations have an annual review. I personally think that's kind of ridiculous to wait that long for it. We need to be giving people feedback much quicker, much closer to the time that it happens. If we do that, then that feedback is effective. If we don't do that, then the person has built a habit that may be very, very difficult to change. And I was talking to somebody the other day, and they were talking about this one particular manager that they were trying to change. And he said, this is like training a puppy. And I said, no, this is training an old dog. This person's been in that job for a long, long time. They have really well built up habits, and those habits have been reinforced for a long time. It's going to be very difficult to make that person move from where they are to where we need them to be. We need a positive work environment, a work environment that encourages people to want to do the things they're supposed to do, that is supportive of correct behavior, that is a place that when they walk in the morning, they feel they can be their best and therefore present their best to those who need it most, the patients. That's the real key, because ultimately, whatever we do in working with our staff ends up being effective, being a way they treat the patient. It ripples all the way down to the bottom. And we've all been there. I mean, those of us, you've been a patient, and you know when a nurse or a CNA or any other person in the organization, a physician, is having a good day or a bad day. We know when we're walking into a toxic environment. I walked into one the other day. It was a quick care. My wife needed to stop in there to have a shot, and so we stopped in, and you could just tell this was not a good place to be. The environment was bad, and therefore it was rippling all the way down to the front end. And good communications. Good communications are communications that are effective in getting the message across to the person at the other end. It's not enough that we say things. It's only enough that the people who we're intending to communicate to appreciate what was communicated to them in such a way that becomes effective. So, putting up signs, putting up a bulletin board, putting things on an email, telling someone something, none of that is by itself good communications. Good communications is far more complicated, as we all know. And adequate growth opportunities. Now, I say adequate growth opportunities because different people want different kinds of growth. We know from our study of people that not everyone is motivated for promotion or more money. Some people want to develop better skills to take care of people better. Some people want stability in the organization. They want to be there a long time. They want to build relationships that work. So being able to understand what they need is a real key to this direction we're going. Now, what makes a good employee? Well, all of those pieces, but notice that first one, good selection. If you select the right people, then you've got someone who's a good match between the job and the person. And the whole rest of it is effective management. So getting the right person in is absolutely critical, and we'll talk about that today. But also, managing that person effectively is critical to making an effective organization. Interestingly enough, some of the same information that you use for the selection process can help drive all of the other pieces. When we look at what assessments measure, we're really looking at what is required for success in a job. And all of the areas there in blue are required for success in the job: intelligence and training and knowledge and skill and experience. And most of them can easily be seen on a resume or on a in an interview. They're relatively easy things to pick up. The tough one is the motivating needs, behaviors, and drives. That's the toughest one to find, and the toughest one for managers to get when managers start working with individuals. If they understand that, they're able to be more effective in so many areas: leadership development, strategic organizational development, coaching and communications, team building. Throughout the whole organization, everything starts to get better when we start to be able to understand the individual. We can drive all of these particular areas in the direction that we want. When we work with organizations to try to improve them, to make top-performing healthcare organizations, we work at a variety of levels. We start with the executive team because the executive team defines what, in fact, this organization is going to be. It can't be any better than the executive team wants it to be, and it can't be any better than the effectiveness of the executive team. We then work through the communications process, and are we understanding people and communicating? We jump down to the bottom and we say, are we attracting, hiring, and retaining the right people so that we're building a core? And then just above that, are the managers doing their job? Are we identifying good leaders? Are we identifying good managers and making sure that what we've got are people who can do the job properly once we give them good people to work for? The bottom line results we've seen over and over again from our studies are just profound. We can drive costs down, accidents down, mistakes, turnover, liability, vacancies in homes. We can drive profits, revenue, patient outcomes, client satisfaction, employee satisfaction, CMS ratings up. All of that by being able to hire and manage more effectively. All of that builds a top-performing healthcare organization. Now, we look at an organization from a lot of levels. We look at the organization as a whole. What is the culture that you're trying to build? What is the goal of this organization? How does it want to be seen by its patients? How does it want to be seen by its residents? How does it want to be seen by its employees? Then we start looking at the teams that are serving various groups. Is that team an effective team? Do we have the right people on that team? Is this a team that understands what it's supposed to do and is singularly as a group focused on that correct outcome? Then we start matching the job with the self. In other words, we want to look at each piece of that team, each individual position, and each individual, and see if those people are a good match for what we're asking them to do. If they are, if we can make sure that we've got the right people matching the right job, and then put them together with an effective team, they will fit into the organization in the way that you're hoping for, and that you will start to drive a high-performing healthcare team. We've looked at a lot of studies over the years of top performers and bottom performers, and it's really fascinating to see the difference between managers in how they are effective in working with their people. We often say that people don't quit organizations, they fire their bosses. And here's a perfect example. We're looking at a study we did on turnover in one organization. And look at the manager on the right had a 223% turnover. In other words, 6 months in, you'd barely recognize anybody in the organization. On the left, we have a manager that had virtually no turnover. Now, the only difference between those two managers, this is a large organization, they had 54 managers we were studying here. The only difference between them was their behavioral style, that little graph at the bottom. And that little graph tells us how that person behaves in their job. Now, we happen to know that the person on the right is a very friendly, optimistic person. And we happen to know that the person on the left happens to do things pretty much by the book. The result is the person on the left who's doing things by the book is putting the right person in the right role. And therefore, people are staying. They may not be in love with that manager. They may not find that manager to be the most fun person in the world, but they like the job. It's working for them. And so therefore, they're sticking around. On the right, we have a manager that may be more fun, but is not as effective, and is putting the wrong people in the wrong jobs. And therefore, we've got a different kind of dissension within the organization, and a dissension that is causing people to leave. That's what you can't afford. Turnover is unbelievably expensive, not only because you have to go out and find a new person for that role and train them, but because if we look at mistakes and accidents in any medical organization, we will discover that a very high percentage of them happen with new people who don't know what they're supposed to be doing or don't know our routines yet, and therefore we've got a problem. When we look at driving performance, let me show you some of the analysis we've done and show you exactly what it drove. Now, in this particular case, what we're looking at is a nursing home, and we have identified the ideal behavioral style for a variety of jobs in that nursing home, and I can show you how it affected that organization. Now, the first graph that you're looking at, and I know those graphs don't mean anything to you. They don't need to. They mean everything to us and to our clients who are trained in this. But that's the ideal pattern for a nursing home administrator, and look what happens. The QMix is improved, employee engagement, staff turnover, occupancy rate, referral growth rate, organizational potential, and their 5-star CMS rating all driven by that pattern. How do we know? Well, we looked at hundreds and hundreds of nursing homes, and we looked at hundreds and hundreds of administrators to determine what behavioral style actually drove that particular factor. And this is what we discovered. When you hire that person, you end up with the right mix, someone who's going to do the right thing. And I can tell you a little about that person just from that graph. This is a person who does things by the book, who tries to make sure things are done well. This is a friendly, nice person, but not overly friendly to the extent of ignoring any of the rules. This person connects well with people. They juggle lots of priorities, and they make good decisions. Put that together, it's a major piece of what makes a good administrator. Now look at the rehabilitation services manager. As you can see, it's a significantly different pattern. There are some common pieces. They are both good detail people. They both tend to do things well. But the rehabilitation services manager tends to work more technically, and it is focused more on the technical details of what they do. And when we hire that particular pattern in those jobs, we get more employee engagement, we get lower staff turnover, we get better rehab efficiency, we get better Part B percentage and Part B minutes, our percent threshold is improved, and again, our five-star CMS rating is improved. So simply by putting the right person in the right role. Here's a couple more that roll out to round out the mix. A DON. Look what happens with the DON. This is a DON who does things, again, very much by the book. This is a detail-oriented person who knows what she's supposed to be or he's supposed to be, and really focuses on those details. But this is also someone who can make decisions, who can solve problems, and make things happen for their team. And when we have this type of person in this role, what happens? Employee engagement improves, prevalence of falls decreases. Isn't that interesting? Just by putting the right kind of person in the role, we actually even adjust things like patient falls. Your ALOS goes in the right direction. Your patient restraints and your physical restraints actually reduce. Isn't that interesting? Another one of those issues, just by putting the right person in. Nursing stability and five-star rating. So all things you want to drive in the right direction. Now, one of the areas we get asked to help in a lot is CNAs. Probably the highest turnover area in many larger organizations, and one of the most difficult areas to hire into and know you're getting the right person. The pattern that you're seeing there on the left is the ideal pattern for a CNA. And look what happens when you hire that type of person into your organization. You get improved dependability, improved adaptability, improved conscientiousness, improved knowledge. In other words, this is a person that will know what they're supposed to know, and improved tenure. They will stick around because they feel like this is the right job for them, because it is. They're in a situation where they're not being chastised or criticized or pushed for doing things wrong, because their natural behavioral style allows them to fit in and do things the way they're supposed to. Now, the most unique one in this grouping is the Director of Professional Relations, and you would guess this is a very different kind of person. This is a non-clinical, and so when we put a person in who is a very outgoing, extroverted person, we get percent to plan. This is a person who goes out and fills beds, makes things happen, brings in patients, and so we can actually drive sales through this also. So what the whole goal here is to say, if we're going to have a top-performing healthcare organization, we need to have the right people in the right role, and we need to do it with the same type of analytics that we use in our practice to diagnose illnesses or problems with a patient. We need to have that same skill, that same commitment to doing things right that we ask of the people in those jobs, and that our patients and clients ask of us. We also know that there's an enormous time saving in using this kind of a process. By being able to use a process like this, we save an enormous number of hours. You can actually cut recruiting time in half by using a process like this. Why is that important? Well, number one, it reduces cost. But more importantly, it frees up your recruitment team to do a better job of recruiting the right people. They're not burdened with high turnover. They're not burdened with kind of a random crapshoot when they're putting people in the positions. So you start to get a more effective team from them, and they in turn are able to operate at a much higher level. Very, very important for the overall effectiveness. Now, when we look at the pre-interview screen, we focus on high probability candidates. We can do that because we will quickly have looked at those who are a good fit for us, not just by their resume or credentials, but also by their behavioral style. Here's the beauty of that. Top people don't last on the market long. Even in this economy, top people move. They will go out and apply with your organization, and then they will apply with 4 more organizations. If you use a behavioral tool, you'll be able to quickly identify that this is the right person and get that right person in quickly. Pre-interview screening done correctly, it cuts a lot of time. If we can look at them ahead of time, even before we interview them, look at their behavioral style, we can save ourselves a lot of time by not interviewing those people who are a poorer match, or at least putting them down lower on the list, so we tend to fill our organization with those people who are the best fit. And we get the best before they're gone, as I just mentioned. It's so important to do that. Look at the kind of difference. This is the kind of look that you get at a person, and it's very interesting. We're looking here at a medical care coordinator position, and what we see are 3 different graphs for each one. This we would see before we ever interview the person. We're looking at what this person is most naturally, which is the top graph. We're looking at how they're adapting to the work environment that they're currently in, which, if they're an applicant, is their previous job. If they're a new employee, if they're an existing employee, is how they're actually working here. And then how they end up working, looking to those people who work with them. Now, what's interesting is we can very quickly identify the below average pattern from the above average pattern. And so we know, for instance, you see this C dot here, that's patience. And we know that with higher patience, with more patience, we're going to have a more effective person in this particular role. So there's a lot more in this graph that I'm not going to go into, just to say that even a frontline recruiter, before they met with this person, would know, I've got a winner if I see this pattern on the right, and I've got a question mark if I see this pattern on the left. So we very quickly can start to use human capital analytics to identify the people who are best for a position. We look at another one here. This is a director of rehab position. I showed you this one a second ago in the other diagram. This is the ideal, and this is the bottom. And they're very different people. You can notice this one little B factor here is way up high on the bottom ranked and down low on the right ranked. Well, simply that tells us that the person on the right is more focused on the technical aspects of what they do. And that makes them a more effective director of operations. That's who we want to hire for these positions. So again, your managers or your recruiters can very quickly use this kind of technique to identify people who are going to be an ideal fit for that position, and therefore drive your metrics in the direction you want for a top-performing healthcare organization. Here's a nurse assistant, CNA, same kind of thing. On the right, we're looking at the best performer. On the left, we're looking at the worst performer. The differences there are subtle, but they're important, very important to someone who's trying to get exactly the right person into the job. And the subtleties are significant. So again, we look at this as a graph. Our clients are trained to look at this as a graph. So they very quickly, before even meeting these people, know whether they're going to be a fit for your specific organization. One of the things we need to do is define and attract ideal candidates. We need to know what an ideal candidate is. So as you're building a healthcare organization and you're trying to build the best, remember you built great facilities, you had a map for that, you built great policies and procedures, you have a process for that. Well, we have the same thing for hiring people. We have something called pro-pattern development, where what we're doing is looking at what you're trying to create in your organization and turning that into an objective tool that reflects the kind of people that will work in that job best. And so it's not like we're taking generic patterns for generic people. No. In fact, we're saying, I know you want to make your facility unique and special. Let's see if we can translate what makes you unique and special, or what you want to have for unique and special, into an objective tool that your frontline recruiters can use to make sure the people they hire will act the way you want them to act, so that you get the kind of organization you want to get. We also look at validation studies. We have done many studies with other organizations, and we can do studies with yours, where essentially what we do is look at all of the people you've got in a particular role. We will rank them, or you will rank them for us based on their performance criteria, and then we will determine what behavioral styles are driving those particular performance criteria, so that you can hire more of the people that are driving the performance criteria the right direction. And we can even show you how to customize the advertising so that you're attracting the kind of person you want. Once you know who you want in your organization, you can actually tweak the way you recruit, so you get more of them coming to your organization rather than to somebody else down the road. Now, we want to make sure that we identify and develop leaders and managers, because it's not enough to just bring the right people into an organization. If we bring the right people in, but we treat them wrong, we'll still lose them. And even if we don't lose them, they won't operate the way they're supposed to. They won't operate in their natural style. So we want to find those leaders who fit the corporate needs and cultures. We need to understand who they will be and search for them within the population of employees and outside. We need to highlight coaching needs. We need to build leaders before we need them. Look at those people who have the behavioral style to be a manager and start to give them the skills and the knowledge so that we can build a succession plan for our organization. You know how disruptive it is when you bring in a new manager, especially when you bring one in from the outside. If we can build them internally, what happens is we get a consistency of operation throughout the entire facility, and that starts to mean a consistency of treatment to our patients and residents. We identify motivations and needs, trying to figure out what do individuals need to be successful. How can we understand them more effectively? Our good leaders, people who understand what those graphs that I just showed you tell us, know that when they're communicating with an individual, they need to give that individual a certain kind of treatment. Some people want sit-down time to be heard out. Some people just want an email. Some people need a lot more detail than others. Some people need to think things through before they can give you their best advice. These are just simple little pieces, but it makes an enormous difference. You know, you've all had the experience of working for someone who understood you and who knew how to get the best out of you and released from you, within you the best ability that you had to treat that patient, to treat that resident the way they were supposed to be treated at the best of your ability. And you've also had experiences with managers who just treated everybody. It felt like they treated everybody like dirt. Interestingly enough, that's how you might have felt because they were treating you wrong. Other people actually might have liked the way they were treating them, but the difference is that manager didn't understand how to adjust to your style. The more we give them those skills, the more the entire facility starts to operate the way you want it to operate as a top-performing organization. We often say it's skill plus insight that gives managerial effectiveness. In other words, many of our managers have the skills to be good managers, but they don't have the insight into the individuals working for them to be able to make those adjustments, to be able to make them as effective as they need to be. So the whole goal here is to be making sure that we're bringing in great people, that we understand what a good person is, and then put them together with managers who understand this person well enough to be able to get the best out of them on a regular basis and make that person feel that they are valued and wanted. I like this quote that says, equally important is to create an environment in which people can flourish. That's exactly what we're trying to do here, and that's what makes a high-performing medical team. A high-performing medical team is a team of people who flourish, who do their best because they're in an environment where doing their best is right. In other words, they were chosen to be there because they're the right kind of person for that job. And their manager was given insight to be able to understand them and create an environment that is uniquely them, that allows them to be the best they possibly can be. When we look at some of the things we need to make sure we're doing when we're implementing this kind of a tool, we need to make sure that it is a tool that is reliable. We need to make sure that it has cross-cultural resource search. We need to make sure that we have construct validity. These are technical things that that any HR person would know that a tool has to have. Fortunately, the Predictive Index meets all of these. It is useful as a pre-hire tool and as a leadership development tool and meets all the requirements of the EEOC for that. So just like you check out every piece of equipment and every policy you have, you should check us out too. Make sure that we meet those standards, and we do, to be used the way you want to use them. We don't believe that an organization that's trying to be its best should be kind of left alone to just read a report as some people do with behavioral assessments. We have a three-pronged approach. The assessment itself, which, by the way, if any of you would like to try the Predictive Index and just see what it's like for yourself so you can experience it, please email me at steve@predictiveresults.com, and I'll be happy to arrange it. Again, that's steve@predictiveresults.com. The education is critical because if you don't know how to use the tool, if someone hasn't taught you, then you're not going to use it correctly. And that goes with everything from senior management to managers to recruiters, making sure that they have the right knowledge to be able to get the best out of the information that they're gleaning from employees and candidates. And finally, consulting. We stay very close with our clients to make sure that we're helping them in every way possible. And I think the fun thing that we see in working with our clients is that the better they get at using PI, the better we get at helping them, because they keep asking tougher and tougher questions. They keep asking us to help them raise the bar to make their organization even better than it was last year, because they realize that It isn't an accident. It's a process. It's an objective process, like tuning up any piece of equipment, like training any person and giving them additional tools. Putting together a better process for hiring, recruiting, and managing people takes time, takes effort, but takes the insight from an effective and valid tool. Sample of some of the clients that use the predictive index, from hospitals to medical facilities, from for-profit organizations to nonprofit organizations. We have some of the best clients around the country. So we're happy to provide you with copies of any of the case studies that we used. Any of the case studies here are available. Most of them are on our website at predictiveresults.com. Feel free to take to look at the client section on predictiveresults.com, and you'll see many of them. If you have questions or would like more information or would like a free demonstration of the predictive index, please feel free to contact us. My name again is Steve Waterhouse. I'm the Predictive Results President here. We have a team of consultants throughout Florida and Georgia to support you, and we'd be happy to arrange to get any information that might be helpful to you. Again, our phone number is 904-269-2299. I'm at extension 102. My email is steve@predictiveresults.com. I appreciate your time this morning. I hope we've given you some insight into how we've helped organizations become high-performing healthcare teams, where they're serving their client at the best of their ability and making an organization that not only is a profitable business, but is a high-performing service organization. Thank you again for your time.